Good afternoon. Welcome to the Genome Tech webinar, mainly devoted to discussing the market which the company operates in and the M&A market trends specific to in vitro diagnostics. The company is represented by Miron Tokarski, President of the Management Board, Michał Wachowski and Charlotte Szech, members of the Management Board, and Clearfield Partners, Edward Gray, Managing Director, and Peter Hude, Partner. The meeting will last around 1 hour. In the first part, the Management Board and Clearfield team will give around 30-40 minutes presentation, and we leave the second part to you for questions to the presenters. Q&A session will take place in a form of the chat. We encourage you to ask questions and answers will be given orally after the presentation. Gentlemen, the floor is yours.
Thank you very much, Małgorzata, for introduction, and apologize for a slight delay caused by technical reasons. Today with a little bit larger group, we have some technical issues with this larger number of presenters. So once again, apologize for that. Thank you very much for joining. And today, as advised, the team beyond Genome Tech, beyond Management Board of Genome Tech, we will be also joined by Clearfield team, our advisors in the M&A process. So starting with us, of course, I'm a co-founder and CEO of Genome Tech. I'm a molecular biologist by training and laboratory medicine specialist, and I'm joined by our Chief Business Officer, Charlotte Szech, and our Chief Financial Officer, Michał Wachowski. Beyond those three of us, there are over 20 people working from Genome Tech across 2 locations, one in Wrocław in Poland and the second one in Kent in UK. And other important people, members of our team, include Małgorzata Małodobra, my colleague and co-founder and R&D director. She's also a molecular biologist. Lee Huntley, our Chief Technology Officer, with over 17 years of experience, who really is guiding the team from the hardware and microfluidic space, and Henryk Roguszczak, co-founder and chief designer in Genome Tech, the co-inventor of optical contactless heating technology. And as I mentioned, we are also joined by Clearfield team, Edward and Peter. So Edward and Peter, if you can introduce yourself, the stage is yours.
Thank you very much for the kind introduction. My name is Edward Gray. I'm a managing director at Clearfield Partners. I've worked for the firm for 8 years, and I've worked in life sciences for well over 25 years in various capacities. I'm in the New York office and work with the Warsaw office, which includes Peter Hude, who's on this call. A little bit about Clearfield. We are a cross-border merger and acquisition advisory firm. We have 34 offices around the world and approximately 400 employees. And we are very, very excited to be working with Genome Tech and our team, which specializes in pre-revenue life science companies. Peter?
Yeah, it's a pleasure and to meet everybody. Partner at our Clearfield Warsaw office. I've been with the firm now for 34 years, specialize in M&A activities and focusing on life sciences, biotech companies.
Thank you very much, Ed and Peter, for this short introduction. So, Charlotte, if you can tell about the market, and I will follow that with technical information about our platform.
Yes, hi, good afternoon, everyone. So I think many of you have been familiar with the Genome Tech story, which is trying to address some of the limitations of the current molecular diagnostics or the genetic testing world. At the very moment, there are not very many diagnostic techniques that can address the clinical need with a quick turnaround time, especially avoiding the transportation of the sample or that of the patient going to the laboratory to give the sample and then wait for 24 hours to get the results. Not to mention that these tests are usually quite expensive when we are talking about PCR, which is the gold standard for molecular diagnostics. This technology is not very optimal if you want to think about it from a point of care near bedside possibility, and therefore at Genome Tech, Miron will tell you more about the story, but which we have been sharing with you for quite some time. On the next slide is the possibility to speed up the testing and provide the results immediately by avoiding the transportation of the sample, by cutting short the analytical procedure, and thereby allowing the doctor to give the results to the patients in about 15 to 45 minutes. This has a lot of positive impact on the clinical outcomes, being able to avoid antibiotics when you don't know whether it's a viral infection or a bacterial infection, being able to accurately control the spread of epidemics, infections, such as the COVID experience that we lived through. And therefore, we believe that we can provide with Genome Tech ID single consultation-based diagnosis and treatment at the doctor's office or at the point of care. Our solution is a very small Genome Tech ID platform, which is portable. It is matched with a consumable, which is a reaction card or a cartridge. This is a single-use cartridge that has IP associated with it. I pass it to Miron to talk a little bit about the IP and how we've utilized it to miniaturize this technology.
Thank you very much. So yeah, in order to move from a typical testing laboratory, typical molecular testing laboratory into point-of-care system, into point-of-care use case, you need to develop new technology. You cannot rely on those technologies that have been previously used in laboratory and trying to fit for purpose for point of care, because those technologies have never been developed. PCR technology has been developed for laboratory testing, not for point of care testing. And those systems that rely on typically PCR-based approaches use very bulky heating blocks. They require a lot of energy. They require very sophisticated optical systems. And we have decided that in order to be able to fit the needs of short turnaround time, of low cost of goods, and ability to mass manufacture with a right price without sacrificing too much of accuracy of our test, that we need to develop new technology. And we started from developing technology of heating, because heating is the core in every nucleic acid amplification testing platform. And we have developed technology of patented technology of photonic contactless heating detection system that simply allow us to create passive microfluidic reaction card, allow us to create different temperatures across the reaction card, and in that way we can multiplex of up to 5 targets on a single reaction card and offering true point-of-care testing solutions. By using isothermal amplification, we are also able to deliver high accuracy of results. We are able to shorten the amplification time while offering high sensitivity, and also it allows us to further optimize the design of our cartridge and also optimize the design of our microfluidic system in general, also the instrument, because it does not require very sophisticated, for example, optical elements to detect amplification, the outcome of amplification reaction. And of course, because we also control the enzyme creation and assay creation, and also we have signed deals for getting those enzymes, we are able to reduce the cost of goods. And going deeper into the technology, here I want to show you a couple of examples why this optical heating technology is quite unique and delivers this unparalleled efficiency in multiplex diagnostic system. So as I said before, we are able to create different temperature gradient of different temperature across amplification zones. So not only we are saving energy because we are heating only specific pieces of our reaction card, but we are also able to offer always the best thermal conditions for particular assay. And here on the slide itself, you can see, maybe this will be possible. I will try to use public cursor if this is visible. I hope that it is. So here on the top left side, on the top left graph, you can see a summary of amplification turnaround time for our SARS-CoV-2 assay for 50 genome equivalents per reaction across two different temperatures, 61 centigrade and 64 centigrade. And as you can see here, the average time to result for 61 is much longer, is 50% longer than the amplification time for 64, which is the optimal temperature. At the same time, if you want to go further, you can also reduce the time to result with a much lower limit of detection, which is 25 genome equivalents. Here, we are able to reduce from 23 minutes at 61 to around 10 minutes at 64 centigrade, which is the optimal temperature for this assay. And then if we move to RSV-A and RSV-B, you can see here that if the temperature is not optimal, you can generate false positive results. And by allowing us to choose freely the temperature of every single amplification assay, we are then able to get much shorter amplification time and also much better specificity rate across all assays present on a single reaction card. And ultimately, it also gives us the very important result of higher specificity and higher sensitivity. So in a nutshell, this technology can also be easily scaled for example, for the oncology testing or companion diagnostic testing, because right now we have 3 temperature zones, but of course it is easily scalable to have even indefinite number of amplification of heating zones if necessary from an assay perspective. So we can create those temperature gradients across a reaction card with a much larger number of targets if this will be needed. So above or beyond those 3 temperatures that are present in GenomeTech ID system, which is also important in terms of much higher plexing assays if required by the final user. And in terms of chemistry, I touched a little bit the point of different use cases of this technology. So we have proven that in this infection disease market, we can deliver nicely working system for 5-plex respiratory panel, that we can also develop technology for other infections like sexually transmitted infections, Lyme disease or MRSA or systematic infections. We have also developed technology of freeze drying so that those reagents are stable in a room temperature. We have developed reaction coverage. Right now, we are in the process of scaling up and cost reduction efforts that are planned. And we are executing this further beyond the just assessment step. And from the analyzer point of view, we are in the late stage validation. We have planned pilot production for a small batch of units. And this product, what is really is designed for this direction. In oncology, we are not there yet. We have assessed the feasibility of INA technologies, LAMP in particular, to detect mutations. And we have focused on EGFR gene. And we have also developed technology for SNP variant detection for companion diagnostics, also in oncology. But it is really important to mention here that oncology is not the only use case for this technology. We can use it wherever we want, wherever detection of mutations is necessary, detection of single nucleotide polymorphisms is important. And for this oncology testing, we have received a non-dilutive grant that we have started early this year that is worth around $5 million for further development of oncology testing. And here what you can see is that this technology for LAMP-based mutation detection is really accurate. We can deal with mixed samples, so wild type and mutated genetic material. We can detect 12 mutations using a single primer set, which is quite unique. In that way, we can heavily multiplex on a limited number of assays, a limited number of amplification chambers, and we can give much higher plexing compared to other isothermal methods. And short time to result compared to PCR, because typically you need to count 90 or 120 or even 200 minutes for amplification using PCR. Here we can deliver the same results in less than 40 minutes, which is really, really remarkable for amplification technology. And of course, we are not stopping there, as this technology based on very solid basis, very, very solid core technology can also be further developed. For example, for viral assays that we have also been working on recently based on some market feedback that delivers those results very rapidly. You can get amplification after around 5 minutes. So this is really, really remarkable also how we can advance this further to reduce the time to result. And of course, we can then create bacterial respiratory panel, HPV panel, sexually transmitted infection panel. So this technology is more towards a platform than just a single use case, which is really important in terms of the market needs. So right now, Charlotte, you can tell a little bit more about the competition in this market.
Yes, sure. Thank you, Miran. So GenomeTech ID is a platform that fits in the world of molecular diagnostics or genetic testing, where many of the products are looking for multiple pathogens or one single pathogen. And some of these results, as I mentioned in my introduction, take more than 8 hours to generate. Some of them take more than an hour to generate. You'll see that the market is quite crowded on the bottom right corner, which are products from like Abbott ID now, the Cobas Liat from Roche, or the Q Health, a company that just went bankrupt, all testing only one single pathogen at a time. So if you're identifying COVID, you can only look at COVID or SARS-CoV-2. You won't have the ability to understand if there are other symptomatic, similar presenting symptoms-based etiologies, such as influenza or respiratory virus, RSV, or atypical pneumonia. And this is in that category of targeted plexing between 3 to 5 pathogens, where we fit in GenomeTech with a result that is available between 30 to 45 minutes. We believe that we're also very economical in the design of the cartridge and the consumable, and therefore GenomeTech has quite a large opportunity ahead of itself when they commercialize this product to go into a market empty zone on the upper right corner. There are large companies that are in the upper left quadrant that you will see that have many pathogens, but they also cost a lot more, as well as take a lot longer time to generate results, which are not always conducive for point of care use. Next slide is a financial slide. I think Michał.
Yes, sure. Yeah, of course, as we recently covered, we have secured financing for our goals. Our ultimate goal is, of course, M&A transaction, but apart from that, we are still working on some organic milestones. We are not standing in one place. We are moving forward, and these milestones are increasing our value every day. These organic milestones are very good known to you. This is, of course, finishing clinical performance studies. This is validation. This is also CE-IVD approval and our oncology product. All of this are supported by PARP grant in amount of 5 million euros, together with recently closed round of 2.5 million euros. all these activities, including also cost reduction, brings value to our company as we move forward.
Yeah, so now we turn the floor over to Clairfield, who has been leading our M&A process. They have been our advisors. They have been looking at the market on our behalf. And Ed will be pleased to tell you a little bit about that, and as well as given a bit of a background on Clairfield itself. Ed, the floor is yours.
Thank you very much for the kind introduction, Sharjit. Let me first start by saying that as GenomeTech's M&A advisor, and since GenomeTech is a publicly traded company, we are limited as to what we can share, okay? And we'll be speaking on a high level. Start by describing Clairfield at a glance. Okay, as mentioned at the outset, we have 34 offices around the world. We focus on cross-border transactions. And while most of our practice is mid-market, we have a very strong niche group in pre-revenue life science companies, and in particular, molecular diagnostics. As a pre-revenue company, the M&A model is different than a company that is established in the market with revenue. And the model we use is a best fit, okay? It is not a timeline specific kind of a model, okay? Next slide. Now here we have a SWOT analysis that has been accepted and approved by GenomeTech's board of directors and management. And it speaks to what, as a whole, GenomeTech, its advisors see as the strengths, the weaknesses, opportunities, and threats from an M&A perspective, okay? Not from an operational perspective per se. And we're going to focus on the opportunities, but first I want to walk through the other three categories. The core strengths of GenomeTech is their focus on R&D activity and the team that has been very successful in this respect. They have built a very strong IP portfolio, and they have taken advantage of the versatility of the isothermal platform, which we'll speak about a little bit more in a few slides. And they chose to focus on two very significant markets, infectious disease and oncology, with the same or very similar core technology. This has led to a design advantage with a small footprint, as you saw in an earlier slide, stackability, which goes to throughput, and miniaturization, particularly with what is effectively a lab-on-chip card. Some of the weaknesses, and this goes to the unpredictability of a very dynamic market. We do have a saturated IVD infectious disease market that up until recently, we saw favoring PCR to isothermal, but there have been recent changes in that regard, isothermal being a nascent technology relative to PCR. So it's going through the normal course of acceptance and use. The lab-on-chip oncogenic diagnostic is early stage, okay? But nonetheless, there is a start there, a very solid start. My understanding, GenomeTech is able to detect 11 indels and SNPs with one of the most common variants, EGFR. Another weakness that they are pre-revenue, which changes the model from a more defined M&A process to a best fit process. And this does limit the number of potential buyers and partners. The opportunities is really where we are focused, and it is dynamic. Recently, there's been a shift in acceptance of isothermal amplification techniques, both acceptance and use. The IVD market continues to grow very strong. And that's really across the board, not just infectious disease, not just oncology, but as a whole. And regulatory approvals are key, okay? Now, threats that exist in the market, it is highly competitive. There is rapid technological change and very stringent regulations that in the EU have become even more stringent. But as for the threat of rapid technological change, we circle back to the fact that they have a very, very strong R&D program, and their employees obviously have built a very strong IP portfolio. When working with a pre-revenue company, we look for gems, or we call them gems, something unique that differentiates. And with Genome Tech, in their IP portfolio as a whole is very strong, but the patented photonic contactless heating and detection system that Miron spoke about in depth really makes this a novel isothermal technique. Okay, next slide. Okay, now as a whole, okay, not Genome Tech specific, but as a whole, where are the opportunities in isothermal platforms? Recently, there has been a greater acceptance and use of isothermal amplification techniques compared to 12 months ago. Coming out of the SARS-CoV-2 pandemic, there was a lot of focus on certain elements that in reality were not as important. One was turnaround time. Isothermal had a longer turnaround time than PCR. And as it turns out, use case studies, give credit to Sherdut Shah for coming up with this market report. The reality is that turnaround time is not as important. And we do see these tier one companies coming to that realization. There were also issues with specificity, which are dated by about 4 years, but that mindset was still there with some companies. The reality is that with the right newer generation enzymes and optimization of the assays, specificity is not an issue. And in fact, I understand that Genome Tech spearheaded that with their own novel proprietary enzymes. Now, on this slide, where does Genome Tech fit in? Okay, actually, can you go back to the previous slide? There we go. No, one more forward. There we go. Stop, good. Okay, let me just work through the rest of these bullet points. Isothermals have the advantage of minimal sample processing. They're cycling free. With PCR, you have to heat and cool up and down, right? You don't have that, as Miron had demonstrated. And that's actually one of their key proprietary assets they have, the contactless heating and detection system. So there's no cycling. And simplicity. It is very adaptable. It could be near patient, point of care, laboratory-based, field-based. And perhaps most important is the versatility of isothermal techniques. Infectious disease is used in genetic disorder screening, oncogenic variant detection, viral load monitoring, food safety. It's a very versatile platform, and a platform with little modification can be applied in these different areas. Now, we always look for trends, and one that's gaining traction, it's been thought of for a few years, but it's just recently gaining traction, and that's with a CRISPR technology. The acronym being clustered regular interspaced short palindromic repeats. We've all heard of CRISPR-Cas9 and gene editing. CRISPR itself is a way of very precisely targeting is a place on the DNA. And It does, for the detection, it does work with a version of isothermal, which is LAMP. It's a much different setup than what Genome Tech has, but it's something we're paying attention to. The most recent issue with CRISPR and isothermal amplification is throughput. I think that's the next biggest challenge. But again, this goes to the versatility. And if CRISPR does gain traction, well, there's isothermal right there to partner with this CRISPR methodology. And there's a breadth of techniques within isothermals. I'm not going to read through all of them, but there are 1, 2, 3, 4, 5, about 6, 7 different techniques that may be used, and they can be application specific. Genome Tech has chosen the loop-mediated isothermal amplification, or LAMP, which is considered best by some peer-reviewed articles for oncology, as well as for infectious disease diagnostics. Okay, next slide. Now, with an understanding of isothermal technology, where does Genome Tech fit? Do they have just one checkbox? Do they have more? Is it solid? So let's go down the list. The first one, increased acceptance and use. Well, specificity issue has been addressed. And in fact, Genome Tech has demonstrated with their newer generation enzymes and optimization of assays that specificity, they believe, is not an issue. Okay. Turnaround time, as mentioned, is not as important. My understanding, and with a bacterial cartridge, it could be less than 15 minutes. The data is not there yet, but that is, I believe, something Genome Tech is looking at. But to do both, which is where Genome Tech is positioned, it is that longer turnaround time, but well within use cases. Genome Tech also has the minimal sample processing. They're cycling free and simplicity. As for adaptability, their focus is near patient and point of care. And of all the versatile areas where they could go to, they chose infectious disease, which is near market. I believe they're in the CE-IVDR process now, and oncogenic variant detection, which is getting an increasing amount of attention. And LAMP, again, with peer-reviewed articles, at the moment is considered the best technology for that. And of all the techniques, they chose LAMP, okay? They are capable of doing, should be HDA. I apologize for the typo on the acronym, helicase-dependent amplification, and RC, I believe, among others, but they chose what is best for their applications. Okay, next. Now, this is general. It's not specific to Genome Tech per se. And again, being very cognizant of the regulations and our role in the process. So on a broad level, the way we work is to look at tier 1 companies that have an isothermal platform or maybe interested in having one. Some examples: Hologic, Menarini, QuidelOrtho, Merck, Bio-Rad, Becton Dickinson, all for various needs may have an interest. Now, I'm not saying there's any conversation with any of these companies, okay? Simply giving examples. And then we have tier 2 companies. That is another path, is the less preferred path, but there we look for complementary approaches. And what we typically do is to do a top-down fundamental analysis of the sectors, and then a bottom-up fundamental analysis of each tier 1 company. Is there a strategic fit? What's in their pipeline? What is in trial? What direction are they going? Have they gone? Do they want to go? And then we would present Genome Tech, and in particular, its streamlined nucleic acid isothermal amplification technique, which is proprietary. And again, going back to the photonic contactless feeding and detection system, which makes it unique. And concurrently have conversations with corporate development, and periodically we would assess and reassess tier 1 and tier 2 companies. Now, for avoidance of doubt, and I have to say this, nothing said here is indicating any type of activity or inactivity or anything of the sort with Genome Tech. This is our general approach, okay? Next slide. Now here, we look at what threats are specific to Genome Tech, not the broader threats in the market. One I discussed in some length with CRISPR-based assays. This goes to the rapid rate of technological change. It's something we're paying attention to. There's an emergence of development with point-of-care CRISPR-based assays, which are reported to be as accurate as PCR tests. They can detect in as little as 5 minutes. However, the biggest disadvantage is the throughput, and it is years away from any commercial viability, something we're paying attention to, and something to explore. When we look at threats, we think to ourselves, how can they be turned into opportunities? Well, LAMP and CRISPR may be used one and the same, not implying that Genome Tech's platform can or cannot do this. In fact, I understand it would be a much different setup, but it's something we're going to watch, okay? More immediate when it comes to threats are stringent regulations, and in particular the CE-IVDR process, which has, how do I say this? The FDA used to be viewed as the more difficult program to get through. Now the FDA looks like cake, okay, is the best way to put it. The European system has really, really clamped down and made it more difficult. But nonetheless, we're confident that Genome Tech will be able to proceed through these processes, okay, and move to a commercial product. Next slide is a disclaimer. Again, we're not officers of the company, we work for the company, and nothing that I have said or Peter may say is to be considered investment advice, directly or indirectly, okay? But this is a high-level overview of the isothermal segment in M&A. And if I could summarize it, recently there's a lot more use and adaptability and acceptance of isothermals. And Genome Tech does have what we call GEMS. Particularly, I think its most valuable asset would be the patented photonic contactless heating and detection system, but certainly their proprietary enzymes, et cetera, go towards the strength in the IP. So that is our presentation. I'll turn it back to Shardu.
Yeah, so thank you very much, Ed. And maybe before Jared will be willing to add a couple of his views on that, I just want to have some kind of summary of what we have provided, what information we have provided so far. So as you can see here, the market is still there, and we are moving forward with multiple of companies that we have approached. We have quite advanced discussions with 3 of them under NDAs. 2 of them are listed on NASDAQ, so they are like top-tier companies mentioned by various reports from this in vitro diagnostic space. And we are still developing the technology. So every single day, every single dollar spent on this technology is moving us forward. So we are fulfilling the requirements based on those discussions that we have with the market. And by saying this, I mean, for example, reducing the turnaround time. There have been there's some willingness to see if we can reduce this for less than 15 minutes for true negative sample. And we are doing this right now for viral infections. And as I said, we see very promising results coming in few minutes of amplification. So we should be able to nicely fit within this less than 15 minutes for viral only pathogens. we are deeply investigating the cost of goods and manufacturing capacity, going deep information coming different vendors on the manufacturability and the cost associated with both setting up the production lines and then the final cost of goods of reaction cards and the analyzer. And this also requires a very large input of our team in order to be able to fit into specific needs of different manufacturers of microfluidic systems. And it's also it also includes the work of biology team that meant to focus on different techniques for stabilization of those reagents in room temperature that have the impact on manufacturability, the cost of manufacturability, the handling during manufacturing process, etc. So we are still moving forward with Genome-Tech ID, and of course we are still moving forward with oncology detection and mutation detection or variant detection, and genetic variant detection in general, where we are still applying for new patents, developing new technologies. Once we will release new patent applications, I will be happy to share more information with this. Those results are really, really encouraging and are really good in terms of time to result and in a very low complexity of how to design those assays that fits the need of companion diagnostic and of the in vitro diagnostic market. So that was a summary from me, Chair, that Michał add. Peter, if you want to add something more, please feel free to do so.
No, I think nothing from my side.
Good.
I think it's been very, very comprehensive. Thank you for that.
Yes, but we should stress one thing. Yes, because we are not standing in one place. Yes, we are moving forward. Yes, we are working on a very important aspects that are touched by our partners, and they are asking about it. So the vision of our company is to increase the value for shareholders every day. So it's not something like we are standing in one point and waiting for transaction to happen. Yeah.
Good. Thank you very much.
That, two keys to success for a company like Genome-Tech, or any company for that matter, is the ability to adapt and innovate. And looking at Genome-Tech's track record, they have met these two. They have adapted to a very dynamic market and clearly have been very, very innovative. And the innovation is with an eye towards commercial opportunity. As much as we know Miran and his team enjoy the research, they certainly have an eye on the commercial opportunity. Thank you.
Thank you very much. So I think that we can skip to the Q&A sessions.
Thank you. Thank you for the presentation. Yeah, let's move to the Q&A session now. As a reminder, please post your question in the chat. So when exactly we may expect M&A transaction to be finalized, partial or complete? I saw Mr. Tokarski on TV saying that this deal should be announced very soon. What type of transaction should be expected by investors? Sell of whole company, sell of the one project, licensing, or sell of technology?
Thank you very much for this question. Yeah, so as I mentioned, we are quite advanced. We have advanced discussions on the NDAs with at least 3, let's call it that way, key players in this market. So we are moving forward with that. Our goal is always to maximize the value from this transaction, value to investors from this transaction. So with as I said, with every dollar spent here, we are moving forward with the readiness, the market readiness. We are moving forward with the technology, with the IP portfolio that we have in genome tech. That typically moves the value forward, because I could not imagine anyone saying that the more IP and the more advanced the technology within the company is, the lower the value is. It's quite the opposite. The more the company has, the more IP it has, the more advanced the technology is in manufacturability, the higher the value is. So we are always looking from this perspective. And as I said, we are moving forward. I will not be able to give you any precise date right now, but it's going in the right direction. I don't know if Ed, Peter, Charlotte, or Miha would like to add something to this.
Yeah, I'm sorry, I lost the connection for a moment. The question I understand is, when may a transaction occur, what type of transaction? That is not something that Clearfield can speak to. As a publicly traded company, any information or lack thereof is material non-public, okay? And it could be construed as investment advice. So that's the only reason why we're not answering that question. To the extent that the officers of the company would like to, they certainly may, okay? And I know this is the number one question is when it's going to happen, right? And but we're not, we cannot speak to that.
Yeah, and in terms of the type of transaction, so of course all possibilities are still open. We are open for all possibilities. Of course, the best solution is to combine both genome tech ID and oncology projects into one transaction. We will see the interest is coming from those companies, is coming from all for one of them. So this is quite a diverse group, and right now this is what we can tell. And from the administrative point or financial point of view, as I said, there are typically two options: either a call for shares or dividend payment as a sell of a particular part of the company, particular assets, and this is always look through the of transaction, how this transaction will be structured, if there will be some milestone payments, and typically there are some milestone payments. So as I said, the type of transaction will be determined by the terms and by the value that transaction can bring to shareholders.
Mm-hmm. First half of the year is almost over, when investors can expect clinical trials results to be published.
Yeah, so those clinical trials are still progressing. We are moved beyond 60% of patients. Right now, summer is not the best time to recruit new patients, as the number of positive cases is quite low. But here I want to because we are recently getting multiple questions relating clinical trials and where we are with the clinical trial. So I want to remind you the information we have shared in May 2022. So this was the time we have registered RP5 so the panel for respiratory tract infections according to IVDD. And registering medical product within the IVDD requires testing on samples, and at that time we have tested 120 swab samples for pathogens present on the RP5 pegs, for false positivity, for false negativity, for interference studies, etc., etc. So we know that the parameters are really good. We have never detected any false negatives, any false positives. The interference studies were also quite good. So we are building on those 120 samples to meet the regulatory requirement. And this regulatory requirement is also changing. So this is changing because initially it was planned to switch from IVD to IVDR with this grandfather period coming to an end in May 2025, so May next year. it has recently been pushed, and this will be finally voted by the new European Commission until the end of 2029, and we also cannot. We can also anticipate some additional changes coming in this forefront. That's why probably it referred to FDA right now as being more stable and more easy approach. But of course, we are not targeting FDA now. We are focused on the IVDR studies, and they are still progressing. We are confident with the diagnostic parameters that we've got, and we have communicated at the time we have registered this system in May 2022. So yeah, we hope that we will be able to get enough positivity rate, because this is prospective study. It's not a retrospective clinical performance study. So we are collecting samples without knowing what type of pathogen it is, or if there is any pathogen, because, for example, someone might be sneezing and coughing because of allergy. So it also is important. But as I said, this is still progressing. Those 120 samples, or over 120 samples, have already been tested in 2022, exceeding very, very good performance in terms of sensitivity and specificity.
How many partners are interested to acquire GenomeTech ID?
So as I said, there are multiple that we are talking to. I don't want to disclose the exact number right now, because this number is fluctuating. Some that previously said no are still getting back to this process. Some of them for the reason, for example, of changing in their strategy, or saying that no, they want to be informed, but they are not interested now. So this number is fluctuating, but we have really been quite advanced discussions.
If that transaction won't happen, for how long do you have liquidity secured?
So we feel very positive about, of course, from a Polish perspective, about the funding that we have right now. We have recently finalized the deal in May of this year for 2.5 million. We have additional this grant for 5 million euros/dollars. So the cash position is good right now.
Do you have any interest from potential big medtech companies to buy OncoSnet project at this level of development?
So we are not specifically talking today about this specific range of who is interested with what type of technology. We are combining this as under the brand of GenomeTech, and we will see how this goes. So we are not targeting any particular portion of this. We want to have one single transaction, and this will be the best option. But of course, we are open to any other possibilities.
What value range of potential transaction is expected for GenomeTech ID and OncoSnet?
Yeah, because as we have pointed several times, we are publicly listed companies, so we cannot provide you any kind of estimations. Those estimations are, I think, that historical transactions are the best estimation of the value that you can get from our other presentations. We haven't focused on this because of the time constraints today, but this is a good opportunity. But of course, the market is changing, so.
I will make a comment on that, and it's a general rule of thumb. The value of any asset to a buyer is the accretive value to the buyer. Okay, and what do they have? What capital outlays do they have? When can they anticipate revenue? How much revenue? So, I mean, yes, we all look at benchmarks. In the same breath, somebody had to set the benchmark, and at the end of the day, it does come down to what is the accretive value? What is the value to a buyer? And the questions have looked at different segments. Well, there you very well may have different values, okay? But that, as an investor, is something you would have to discern independently based on the facts and opinions that you form as you know them to be. So that comes from my years working in investor relations also, okay? But that ultimately is what you need to rely upon.
What are the timelines of the most important R&D milestones in 2024-25?
Yeah, so because it's R&D, it can always be it can always move a little bit. So as I said, this year we want to focus on finalizing the technology development for oncology, testing with ability to detect also single nucleotide polymorphism. As I said, this is something that that is really advanced. We want to get the estimations on the cost of goods and the COGS and capex related to manufacturability of reaction cards. We are also developing this short turnaround time viral plex assay based on the market feedback. So this is around something around this, and of course clinical performance studies for the IVDR. But this is something that will happen later this year or early next year.
Does the company have a presentation video of the device in operation?
This is on our some kind of operation, more or less. It's available on our YouTube, but we have also showcased this multiple times during first. So there should be something also on LinkedIn account, probably.
What are the next steps? Are there any requirements for potential buyers that are required?
Yes, as I said, there are. We are exchanging information on their NDAs related to technology, related to assay, related to cost of goods, etc., etc. So, but I don't want to be too specific on what those requirements are, but they are around technology mostly.
Mm-hmm. One more question about M&A is it the matter of price to finalize the deal, or is it something else?
We don't want to comment that specific questions.
Mm-hmm. Is obtaining IVDR crucial to the transaction? Is this what buyers want?
I'll answer that.
Not so far. Yeah.
Go ahead, Mira. I'll give you. This is a general answer. With a buyer, and again, this isn't specific to Genomtech. This is just a general metric. Okay. Buyers have risk profiles. Okay. How much risk are they willing to take? What are they willing to pay for that risk? And when it comes to regulatory approvals, empirically, what we may see for a product that has commercial opportunity is when you get to that threshold of certification, valuation will step up, okay, because that is de-risked. When you get traction in the market, valuation steps up because there's less risk. Valuation and risk are inversely related, okay? But it also goes to the buyer's risk profile, and buyers have a wide spectrum of risk profiles, and also factored in is how important is the asset. Is it a component that they're interested in? Is it the whole asset they're interested in? Okay, but as a general rule, of course, certification de-risks and adds value. Commercial penetration de-risks and adds value. Okay, Miron, please. I know you wanted to mention something.
Yeah, so I think that you have properly answered this question, but what I wanted to add is that there are some different use cases for this technology. Some players are maybe less interested in respiratory. They may be interested in a different assay. So of course, in such situation, regulatory approval is a little bit less important. Let's call it that way. If their risk profile and their needs that they need to address are a little bit different than what we are doing so far.
I think more goes towards the capability of the platform than any particular, let's say, the current panel, okay, the current assay, it gets approved. It speaks broadly also to the capability of the cartridge, of the platform itself.
Beside the very strategic development approach, is there room for more opportunistic activities, for example, targeting SSTS or tropical infectious diseases, to access more external funds, public, for example, Gates Foundation, and particularly get the company on the radar screen of financial or strategic investors?
So Jared, would you like to get this question?
Yeah, sure. There's always varying areas of interest, and it's a fine balance between what a company such as Genome Tech, with the size of 22 people, will choose to do with the resources it has and offset that with the return on that investment. So I think funding opportunities are very exciting. Non-dilutive ones particularly are extremely encouraging. We have seen that many of these grant opportunities also require co-funding and a contribution from the company itself. So as you saw in our presentation slide, we've identified 3 different areas of lower hanging fruits, which have a huge upside on the commercial side and an interest from sort of the portfolio and the menu development. And therefore, we've chosen to focus ourselves first on these areas. So these being the respiratory area with the respiratory panel, the women's health with STI or sexually transmitted diseases, looking at CT&G, then the HPV panel. Of course, Miron and the team have done quite a few other assays as well, which historically you've seen in some presentations and some materials around Borrelia and Lyme's disease, where we filed for a patent as well, the market opportunity being very limited there. We've deprioritized it. The area for oncology, which we're going after, which is very early stage right now, is also yet another sort of strategic development on our front. And I feel that right now we're in this area of focus, have enough proof of concepts available with the right data and the right technology and the right evidence, so that the potential buyers can actually look at the versatility of the platform.
At what stage are those NDAs that you mentioned? Talks has just started, or are they on advanced stage?
We have shared very detailed on the level where we are and how, because we are a public company, we will not comment any further.
Is the company at the stage of organizing the due diligence process?
Once again, very detailed questions. So for the sake of this transaction, we will not be able to answer.
Could you let us know what is the extract role of Mr. Garslow and Mr. Hawkins in the company?
So Mr. Gerlasco and Mr. Hawkins are members of our supervisory board, so they are providing advice. They have very big experience in this IVD sector. Trevor in particular also in the microfluidic space in the HP division of diagnostics with microfluidics for multiple years. So they are opening new doors. They are giving very good feedback in terms of the market, in terms of our technology, where we should be going, what might be the best fit for us, etc. So,
what is the schedule in this kind of processes? NDAs, then some conversations. Then what? Non-binding offer at least for one investor. Then due diligence 3 months, and finally binding offer. Any hint here? Thank you.
So Ed, Peter, would you like to get some view on that?
Let me just review the question.
On the typical...
Okay. First, as you said several times, we cannot speak to any details, okay? Because that would influence the decision, could influence the decision of investors, right? And second, there's no guarantee, right? It's not as if this is a linear stepwise progression. You get step B done, you're on step C, you don't go backwards. These are very dynamic. these processes. And I've really rarely seen one that is just very, 1, 2, 3, unless it's a revenue company or more in that line. But we can't really speak to any particular state, okay, or give any assurances. I mean, that's just by regulations, we're not allowed to do that. As much as I know you want to know, okay, we're not allowed to do that.
How your low valuation in the Polish market transforms to difficulty in obtaining the right premium in a strategic transaction?
So I will start, and then it may be taken by the rest.
I will mention them. Yeah.
Yeah. So yeah, yeah.
Oh, go ahead, Mary. Go ahead.
Okay. So as you know, the value is quite public, but the number of or liquidity of those shares compared to bigger companies is quite low. So obtaining, even if you assume that obtaining a medium or average price for all shares wouldn't be possible in this price. So that's something that you need to account. And of course, this is not the only value assessed by prospective partners, and more on that, they will probably be able to share his view.
Yeah, I'll mention just a few points. I think first and foremost, from my experience, and I've in various capacities over the past 35 years, have worked in market surveillance, stock watch, proxy fights, friendly hostile takeovers, et cetera, and track publicly traded companies in many different capacities. When a publicly traded company is thinly traded, when the core investors, there's a large retail component, you do not have a fair value. And a fair value is not discerned by a potential acquirer for a thinly traded stock. Further, I mean, if you look at a company like IBM or Merck, where they're trading hundreds of millions of shares a day, you have a more precise value. But that's not the case with a lot of these smaller companies. So we do not consider the share price of a thinly traded stock as a metric for valuation. There is a very sophisticated negotiation that happens when it comes to determining a valuation. And once or twice, I may have had a buyer make the argument, well, here's where the stock trades at. And I said, congratulations, you can read the stock chart, but that is irrelevant for the reasons I just gave. Okay. What is the value to you? What is the accretive value? Okay. How bad do you want the asset? And then we think about objective metrics. Okay. I mean, at the end of the day, they want to know, when are they going to make money? Is it tomorrow? Is it a year out? Is it 3 years out? What's their capital outlay? What's the risk associated? And then we can both kind of come to a meeting of minds as to what is a fair value for this one particular company. You know, if one company is specific, we only do infectious disease, we don't want any other versatility of this platform, well, that's where that value is going to be. If there's another company that's more versatile, that says we like all these other areas, well, that's a different valuation. But when it comes to share price for micro-cap and small-cap companies, whether it's in Poland, whether it's in the United States, they are very rarely reasonable metrics for valuation. And it's not something that we pay much attention to, and it's not something we let become a part of a negotiation. Okay, I hope that is a fair answer. Sherdu, your thoughts? You're muted.
No, I think that's quite accurate. I would also say that there are many areas of valuation which are dependent on particular buyers. So a particular IP might be very applicable in the infectious disease diagnostics area where we are, but to a potential buyer, it could be, for example, very valuable in another area of animal diagnostics, animal health, or for other applications. And these valuations are, again, based on that accretive method that Ed has highlighted. So we've seen very often in large companies when we are on the other side of the table that valuations of smaller startup companies don't usually get in the way. It's based on what is the accretive value and what is the strategic use of that. And then on the counter side for a smaller company like Genome Tech, what is it that they and their shareholders and their investors expect? And I think it always is in the interest of the shareholders. So these valuations often take a toll of its own, if you will.
Yes.
Thank you. The last 3 questions, and we will be finishing this webinar. What was Genome Tech goal to organize this webinar together with Clearfield?
So this was coming from you investors who want to get more in-depth information about the market and where we are, how the market looks like, what are the trends. So based on the feedback that you are sending to the company, we have responded and add with Peter you their time to us, devoted their time to ask the company to meet with you.
I think from our perspective, I'll just add to that. From our perspective, it was an opportunity to speak broadly about the isothermal segment, okay? And very, clearly make the, how do I say this? To make it very clear, as to what we can speak to and what we cannot speak to. And investors always have that question, when is a transaction going to happen? What is the value going to be? And there are deals at the last minute that fall apart. Okay, there are companies that have no interest that come back. I mean, it's very dynamic. It's very hard to predict that. But more importantly, the regulations, whether it's in Poland, the EU, UK, United States, they're all very similar regulations. You can't base your decision. That's not something we're allowed to speak to. Okay, so our role was coming into this, I think, very limited, but nonetheless to speak to the isothermal segment in the market and the strengths of Genome Tech. Okay, does that help?
Thank you. Whether potential buyers and partners are identified, is the process still ongoing?
Yeah, so they have been identified, but as we have mentioned, or Ed has mentioned, this group is still fluctuating because of different strategic decisions on prospective partners, and so it's never a job done, just still being updated on quite often.
Thank you. And the last question, is the company aiming for 800 clinical samples? Can the number be smaller or larger?
So as I said, because this is prospective study, so the positivity rate is the most important aspect. Negative samples, you can always get negative samples. So this number can fluctuate both. We can get less and we can get a little bit more, depending on the positivity rate.
So, ladies and gentlemen, thank you for the participation in the Genome Tech webinar. At the same time, we encourage you to follow the company's developments and events and to contact us if there is any other question that require further discussion. We are available for you. So thank you one more time and see you next time.
Thank you very much. Goodbye.
Thank you, everyone.
Thank you.
Thank you.